Okay, so good morning, everyone. Thank you for joining us on a Saturday morning for our instruction course, that is Perfect Guide to Corneal Imaging. It will be taken by three panelists, that is me, myself, Dr. Shana Sood, Dr. Sanjana Vatsa, and Dr. Aparna Nayak. A brief introduction, I'm Dr. Shana, and I'm a phaco-refractive and cornea surgeon at Port Blair. Dr. Sanjana is also a phaco-refractive cornea surgeon at Bangalore, and Dr. Aparna Nayak is a phaco-refractive cornea surgeon at Udupi. Our fourth panelist could not join us due to an emergency, so I'll be taking that topic. What are the scans we're going to cover? Corneal topography is a must-know for general ophthalmologists, for residents, and also for first-year fellows, ASOCT and specular microscopy. So let's begin with the first one, that is OPSCAN. Beginning with corneal topography, there are 5 important concepts for everyone that is a must-know. We'll be covering these important concepts one by one. The first concept is with rule and against rule astigmatism. As we all know, cornea is not a hemisphere, it's a prolate structure. That means one axis is a steeper axis and one axis is a flatter axis. So in corneal topography, the steeper axes are seen as warm colors and the flatter axes are seen as cool colors. By warm colors, I mean yellow, red, orange, and by cooler colors, I mean green, blue. So when you see a steep axis at 90 degrees plus minus 15 to 20 degrees, that is with the rule astigmatism. When you see a steeper axis at 180 degrees plus minus 15 to 20 degrees, that is against the rule astigmatism. Let's go with the next concept. The next concept which you need to know in topography is what is best fixed sphere. So like we suggested that the cornea is not a regular hemispherical structure. In the central area, it's a little more steep, and in the periphery, it flattens out a little. So what is best fixed sphere? Assuming this is the cornea curvature, the best fixed sphere that fits into it is the topographical best fixed sphere. Elevations from that sphere give us positive values and depressions give us negative values. So this best fixed sphere is different for the anterior float and it is different for the posterior curvature. So different for the anterior curvature of the cornea and different for the posterior curvature of the cornea. The third concept which we're going to cover is what are the zones in the cornea. The zones in the cornea seen topographically are the 3 mm, 5 mm, 7 mm, 9 mm and 12 mm zones. Most of the pathologies take place in the 3 mm, 5 mm and the 7 mm zones. So these are important zones topographically. And we'll be seeing irregularities in these zones and how they're important as flags in keratoconus. The fourth concept is what is bow tie. So if you flash a light in a dark room on a prolate structure, that is a structure which has a steeper axis and a flatter axis, for example, this base wall, what you would notice is that light distributes itself in a bow tie fashion. That means like the men wear those bow ties, no? That kind of a bow tie fashion. So this bow tie is very important in topography as it gives us typical patterns for a normal cornea and for a pathological cornea. Types of bow tie that are seen are the symmetric bow tie and asymmetric bow tie. The symmetric bow tie is where the upper lobe and the lower lobe both are equally in size and equal in appearance. An asymmetric bow tie is where the inferior part is larger or steeper, is as seen in the second image, that is asymmetric bow tie with inferior steepening, and the one next to it is asymmetric bow tie with superior steepening. So concept number 5, what is skew in radial axis? As you can see here, there's a symmetric bow tie pattern formed by the yellow colored lobes on the curvature map. This bow tie is asymmetric as the size of the lobes differ a little bit. The radial axis of the lobes form an angle here. If this angle is more than 22 degrees, it is known as skew in radial axis. In this case, there is only an asymmetric bow tie, but no skew in radial axis. But in the images that I've put on the right side, on the extreme right, you can see an asymmetric bow tie with a skew in radial axis. Moving on to the corneal topography, number 1 that we're going to discuss is OPSCAN. Principle, most of it is theory. It uses 2 mechanisms, that is the slit scan, where it does 40 scans of 240 points each, and the Placitos discs, which creates mires on the surface to pick up topographical values. So what does an OPSCAN look like? To study an OPSCAN, we're going to divide it into 3 parts. The part 1, like I've given here, we're going to study the anterior float, the central values, and the posterior float. Part 2 is our keratometric map, and part 3 is our pachymetry map. So let's move on with interpretation of part 1 first. The most common indication for OBSCAN or corneal topography is keratoconus. And what are the important values to look at are these values that I've just consolidated in one slide. So if you want, you can take a screenshot or you can just click a picture. We'll go by these values one by one. So let's start with the first one. So values in part 1 is when we see the floats and we see the central values. What do we have to see? I have written here posterior BFS, that is the posterior best fixed sphere. So what is the posterior best fixed sphere? It is the posterior curvature of the cornea and the best fixed sphere. What are the values that you get? I've indicated it in a red circle in the slide. So the posterior best fixed sphere for a normal patient, it should be less than 52 diopters. For a keratoconus suspect, it is 52 to 55, and abnormal definite ectasia values is more than 55 diopters. The difference that is the most elevated point to the best fixed sphere, again, this is indicated by a green oval inside the slide in the image of the scan. A normal value is less than 0.04. Suspect for keratoconus is 0.04 to 0.05, and abnormal is more than 0.05. Next comes the ratio of the anterior BFS to the posterior BFS. This ratio is not given as such in OB scans. As you can see, these two white ovals that are marked in the scan, the first one that is to your left is your anterior BFS and to your right is your posterior BFS. So you have to sit and numerically calculate the value. The normal value is less than 1.21. A suspect is 1.21 to 1.27 and abnormal is more than 1.27. Moving on, let's start interpreting the central values. Like I said, the centrally placed highest point is very important because in keratoconus, the displacement of the ectatic area is inferior or inferotemporal. So this centrally placed highest point is here. So this looks like a normal scan. When the centrally placed highest point is inferiorly in the 3 to 5 mm zone, that is a marker for keratoconus. Similarly, irregularities less than 1.5 in 3 mm zone and less than 2 diopter in 5 mm zone is normal. However, irregularity more than 1.5 diopters in 3 mm zone and more than 2 diopters in 5 mm zone is abnormal ectasia. So what we have to see here is where is the highest point, where is the warmest color. If the warmest color is in the center, it's usually normal, provided the K values and the rest of the thing is normal. Typically in keratoconus, the displacement of the highest area will be in the 5 mm zone, 3 to 5 mm zone, inferior temporally. Values in part 2, what do we look for? So part 2 is a keratometric map. So the K values that we have to see less than 47.2 diopters is normal. 47.2 to 48.7 is a suspect and more than 48.7 diopters is a definite ectasia. The next we have to see is an irregularity profile. Less than 3 diopters difference in superior and inferior values in 3 mm zone is normal. However, if there's a more than 3 diopter difference in K values in central 3 mm zone, superior and inferiorly, it is abnormal. So for example, let's calculate it for this map. As you can see in the 3 mm zone in the first circle, the superior value that is circled in black is 45 diopter and the inferior value is 44.7. So if we take a difference of this, we get 0.3, that is 45 minus 44.7, which is less than 3 diopters. So this is a normal profile. This is not an irregular profile. Next, we move on to the topographical pattern. Symmetric bow tie is a normal pattern. However, asymmetric bow tie with skew and radial axis is an abnormal pattern. The next important values are K mean power in the map should be more than 46 diopters for keratoconus or total mean power should be more than 45 diopters. The scans that I'm showing here, this one right here is a normal pattern as K values are all below 47.2 and we've discussed the bow tie pattern. Values in part 3, that is the pachymetry. What do we have to see? The thinnest point more than 470 microns is normal. If it is less than 470 microns and outside the 5 mm zone, then it is abnormal. The difference between any one pachy in 7 mm zone and the thinnest pachy less than 90 microns is normal. 90 to 100 is suspect and more than 100 micron is abnormal ectasia. Also, the difference between pachy at 7 mm and central reading should be calculated and less than 20 microns is typical for abnormal ectasia. Also, thinnest point should be more than 30 microns thinner than the central reading. So these are all values that you have to sit and calculate in an OB scan. And to definitely diagnose as keratoconus, you have to look at all the floats and all the values. It's not just one value. Let's start interpreting. So not all spotters are pathologies. Let's see a normal op scan first. You can see the anterior float, posterior float. The values are given over there, the keratometry map and the pachymetry map. The anterior float, posterior float, BFS values are within normal limits. Keratometry map shows symmetric bow tie with no inferior steepening. Pachymetry map shows normal values. Irregularity in the 3 mm and 5 mm zone are as discussed within normal limits. So this is more or less a normal op scan. Moving on, let's come to the most common spotter, that is keratoconus. Let's see the anterior float, posterior float. You can see warm colors indicating elevations, increased irregularity in the 3 mm and 5 mm zone. The irregularity in 3 mm zone is 4.2 diopters, that is more than 1.5. In 5 mm zone is 3.9 diopters, that is more than 2.5. Also, pachymetry map shows thinning, and if you see the keratometric map, the values go down more than 49.3. Yeah, so all of these together, when put together, give us the diagnosis of keratoconus. The next important op scan is pellucid marginal degeneration. On pellucid marginal degeneration, you typically see the bell sign, which is seen over here. Inferiorly, there is elevation. It also gives the typical crab claw or kissing pigeon sign seen in keratometry. And against the rule, astigmatism differentiates it from keratoconus, which is with the rule astigmatism. More about the details of what is Bell's sign in PMD, it is seen in the pachymetry map, thinning of the inferior cornea, and it gives a typical appearance of a bell and its gong as seen on the right side. The reference is JP Digital Book of Corneal Topography and Sinjap's Book of Corneal Topography. The next important spotter is post-myopic ablation. As you can see, there's flattening or blue areas that are noticed, cool areas on the anterior map. Keratometry map shows decreased K values corresponding to flattening on the elevation map. Pachymetry map shows thinning corresponding to low K values and flattening on the map. So this is the post-myopic ablation. This is a refractive patient that underwent PRK for myopia. Thank you, and we'll be moving on to the next topic, Dr. Antina for PeltaCam.